Welcome to Dr Yusra podcast. On this podcast, we are going to be talking all things aesthetic, wellness, and debunking some of the myths that are going around in the aesthetics industry. We want to help empower our patients to better understand aesthetic treatments and really help you to make an informed decision on your aesthetic wellness journey. My name is Dr Yusra. My background is dental surgery and head and neck surgery. I run a clinic in Liverpool, Crosby by the beach, and in London, Harley Street. And today I am joined by Dr. Lauren. Dr. Lauren is one of our long-standing aesthetic practitioners. Lauren, you've been working with us for over a year now. You've completed our mentorship program alongside me. You do all things aesthetics, injectable skincare, pigmentation treatments, CO2 laser. You're very well experienced, and we have loved having you in our clinic.
Thank
You
you.
travel all the way from Newcastle.
Yes.
Our patients love you, and you love being here, I think.
Yes, I do.
So tell us more about you.
Yeah, so I'm Dr. Lauren. My background is also in dentistry, as you know. I kind of split my time between dentistry and aesthetics. Originally from Ireland, if you couldn't already tell, from a little place called Derry. And yeah, I've been doing this now for about 3 years in total, a year at Yusra's clinic. And yeah, I'm just loving it. It's great. It's a lovely place to work. It's such a nice job to do as well. It doesn't really feel like a job some days as well, which is also a nice bonus.
Yeah, and you've had a super busy day today. You've
Yes,
had a whole array of different treatments.
Yeah, real different.
It's a busy clinic.
Yes, always busy, but that's a good thing.
Yeah. So what do you love doing?
So I think my favorite thing is probably like profile balancing. So with dermal fillers or now more like biostimulator treatments is great for enhancing skin quality. I do like everything.
Yeah.
I find it really hard to answer that question. I never have one specific, but if I really had to pick, probably profile balancing.
Profile balancing. It makes a big difference to our patients, doesn't it?
Yeah,
It's
that's
not
the nice part.
It's not just the aesthetics or the change on the outside, it's also the change on the inside. I think a lot of patients that come to see us because of something that really impacts them. And it's not like a whim decision. They've been thinking about it for years. They've been watching us for years. They want to know that we're good at what we do. But also it's something that often has affected them for a long time, whether it's acne, scarring, hyperpigmentation, a bump on their nose, a weak chin. It's something that they have always been conscious of, but just weren't brave enough to take that next step.
Yeah.
So I think one of the things that I love seeing is that emotional change as well.
Yes, there's a lot of tears, but usually good tears.
Good tears, exactly. Happy tears.
Yes.
And it's magical. I always say there's magic in these four walls. It's always amazing to be just a part of that journey and being able to witness those changes. I think, you know, the times are changing.
Yeah.
And I think we're in a really exciting time in the aesthetic industry. We are no longer focused on vanity alone. We're moving towards being focused on wellness. And people are starting to understand that actually they're seeking treatment as a means of self-care and self-improvement, and that stigma associated with treatments is breaking down, and it's about time. I always say in dentistry, and you and I both know this, when patients come to see us for their teeth, they don't like their tooth, or they've got crooked teeth, or they've got black fillings they want to change, or whatever. There's never stigma. They're never apologetic.
No.
And society never shames them for it.
Yeah.
They're kind of celebrated. You know, people. I often say that when people have their teeth and they want to get their teeth straightened, society says to them, "Yeah, go get your teeth done." Yeah. And it's something you should do. So it's not just celebrated; it's encouraged.
Encouraged, yeah, for sure.
And then as soon as it comes to straightening their nose, it's you know, why don't you just accept that? Like what is with that judgment and that it's awful, that shaming, and I think it's because they don't understand.
Yes.
But I hope that there's one thing that we can do is break down the stigma that what we do is skin deep, because you and I know that it's not.
It's more powerful than that, for sure.
Way more powerful. And often we see patients who come in to see us and they say, you know what, I don't want to go on that date. I don't want to, even when I'm driving, if I'm driving and I have to stop my car at a red light and someone's sitting next to me and I've got a bump on my nose, they hate it, and they'll stop back so that no one can see them. So these are the little nuances that impacts their everyday life. Even how they wear their hair. Like now you're wearing your hair up, you're gorgeous, you're confident. A lot of people don't want to wear their hair up because they don't want their face to be in full view. And actually, sometimes that's because of their nose or their chin, and you correct that, and suddenly it's not just that when they come and they see me a year later, They don't say to me, oh, I love my new nose. They go, I don't even think about it anymore. I
Yeah.
wear my hair now how I
Yeah.
want. I've gone on that date. I've gone on that first job.
Uh-huh.
It's that change.
Yeah, absolutely. It's always lovely when you see patients a few months later, and before well, as they just walk in the door, you can just tell
Yeah.
that they've got increased confidence. They're walking like higher, prouder, and it's lovely to see that
Yeah.
actually. So yeah, it's a real nice part of the job, isn't
It's
it?
amazing.
Yeah.
We give them back their mojo.
Yes.
Yeah, I think it's not just, I'm a strong believer that it's not just the outside, it's the inside. Now, another part of the things that we're seeing changing rapidly, I think, is the movement towards what I call skinimalism. People looking for treatments that help them have healthier
Yes.
skin. And they're moving away from this cookie cutter approach and overfilled faces, thank God.
Yes.
Right? Because that was something that I think was quite scary. The trajectory of the aesthetic industry was going down overfilled faces, trout pout, duck
Yeah.
lips, hamster cheeks,
Yeah.
and Spock brows, all giving aesthetics a bad name. And I think it was scaring people. People didn't want to have these treatments because they didn't want to look fake.
No.
They didn't want to look done. And they associated aesthetic treatments with that look.
Yeah.
But you and I know that actually so many people are walking around having aesthetic treatments and they just look their best self. So do you agree? Do you see that as well?
Absolutely. It's a real barrier to treatment, I find. Speaking with patients, speaking with friends, family members. But it's starting to change a little bit. But I always say it's the bad work that you notice, isn't it?
Yeah,
Whereas when
absolutely.
it's done as you need it holistically, you
Yeah.
just look good.
Yeah, exactly. So it's like, is it her? Is it Maybelline? Is it her genetics? No,
Yeah.
it's Dr. Yusra. But that's the idea, is that good aesthetic treatments are undetectable,
Yeah,
right?
that's it.
So what do you see? You've been in the industry for a while now. You've been treating patients for a long time, and things change rapidly.
Yeah.
What are you seeing as the trends or the upcoming trends in the industry?
For sure, it's definitely, like you said, like people are more interested in their skin health and what they can do to support that and enhance that. So there's a huge demand now for kind of more biostimulating treatments rather than just filler. Treatments that are going to stimulate collagen, support the health of the skin, help with fine lines, wrinkles, scarring, acne scarring. So it's a real exciting time for more regenerative medicine within the aesthetics cohort. So yeah, I really love providing those treatments at the moment.
Yeah. Regenerative medicine is huge. And it's been around, regenerative medicine itself has been around for a while, hasn't it?
Yes.
So things like PRP and using stem cell therapy to regenerate half your liver or your bones. And now we've taken that science and we've now moved it and morphed it into utilizing it for skin aging.
Yeah.
And more so, we're looking at age as, and I hate to use this word, but almost like a disease. So we're starting to realize that actually aging lends itself to increased risk of disease. And when I say that, let me explain before the barrage of hate. I am definitely not anti-aging. I am pro-aging and pro-positive aging. You couldn't pay me to go back to my 20s. But we know that as you age, your skin starts to change, the cellular structure starts to change, right? So you get these a spike in matrix metalloproteinases, these little cells that come and break down collagen. You get more inflammatory cytokines. You also get, and inflammation is the enemy of skin health. And we always say inflammation results in aging. So actually what you want to do is reduce inflammation to stop aging.
Yeah.
So we call it inflammaging, right? And we can have inflammation on the outside, so on the skin, and inflammation on the inside. And now we know that some of the treatments that we do can change that inflammatory pathway and actually impact your epigenetics. So this concept I find really exciting because your genome is programmed, and your aging in a way is programmed intrinsically. So if your mom aged well or your dad aged well, or they didn't age so well, you might not age as well.
Yeah.
So it's intrinsic aging. And then there's extrinsic aging, so aging that occurs because of lifestyle or because of sun exposure. And we know that that can actually cause damage to your DNA and it can cause your phenotype, so the way that you look, to actually change. So if we can change the epigenetics and we can influence the phenotype and reverse phenotypical aging, that's really powerful.
Amazing.
It's amazing. And it means actually if we can do that, you don't need as much anti-wrinkle treatment. You don't need as much dermal filler. And I think this is something really to celebrate and something that is important to proactively understand. because too often I think patients think, oh, I'll just wait until my lines and wrinkles are really bad and then I'll go and have toxin. They don't get that actually, number one, toxin is a preventative treatment. It can't reverse lines and wrinkles. And number two, fillers are volumizers. They are there to replace lost volume in the face. And yes, you will lose volume in the face.
I always say to patients, there's 5 layers to the face. Essentially, you've got your skin. We know the skin goes through changes from environmental factors, etc. Then we've got a little thin layer of fat, subcutaneous fat. Then we've got muscles and ligaments, and then we've got a big layer of deep fat, and then we have the bone. And all 5 layers, they're aging, and we can target all those layers. And it's all about that holistic approach about, every layer is aging in the same decade. I know you say that a lot. And we're so lucky that we have different devices, different injectable treatments, different things to, treat all this. So regenerative medicine now is just, that cherry on top, because we can really help the skin produce more, and you're going to get better results for all those other treatments such as the injectables, etc. So it's a really exciting time.
It is. And I think, what, fillers and toxin are overrated. I think they're overused, and I think the problem is that too many clinicians only have filler and toxin in their repertoire of toolboxes, and so all they know to do is inject, fill. And if all you ever have is a hammer, everything looks like a nail. So I think that's a real problem, and that's what results in this overfilled look, these trout pots, these hamster cheeks. It's because people keep thinking, oh, well, you're aging, let's put more filler in. And then 5 years later, they come back and, oh, you're still aging, let's put more in. Actually, no. Fillers should only be used as volume replacement. And I'm really quite strong on this. And I think, like you say, all layers of the face need to be in the same decade. And you will lose volume. So there's definitely a place for fillers to replace lost volume. But you're going to lose volume in the bone, so the deepest layer. You're going to lose volume in the deep fat. And that's your structural support. But what about muscle laxity? What about degeneration of collagen, elastin in the skin? You can't really replace that with hyaluronic acid fillers. But now we can actually stimulate new collagen in our skin with regenerative medicine. And there's lots out there now. And it's such a booming market. And I think it's going to get better and better and better. And as with all these things, I think you need to approach with caution. You need to understand the scientific background, and you need to choose the right products and understand the risks associated with each product, because each product does come with risk, right? So we've got polynucleotides, we've got Radiesse, we've got Sculptra. Tell us a little bit more about what you like using for regenerative medicine and why.
So I use a lot of Radiesse, which is just fantastic. I really love treating with this product. So what Radiesse is, it is a biostimulator with calcium hydroxyapatite in it. And how it works, it helps your body produce more collagen. So it kind of provides a scaffold underneath the skin that when we inject it, you're going to see a little bit of a result straight away because it is a gel, but over time, over about a course of 3 months, your body's going to produce more collagen, and it's fantastic for around like the jowls, for tightening this area. It can be used along the cheeks and everything as well, so it's just great for the skin quality. You're going to increase hydration. It can help with fine lines, wrinkles, laxity, and it's a really lovely treatment. Patients have been loving it as well, which is always great. So that's what I quite like to use at the moment.
So calcium hydroxyapatite is something that's been around for a really long time, but a lot of people have been scared to use it, right? So it was controversial at one point, and that's because it can't be dissolved. And I think people worry, oh my God, if I'm going to have calcium hydroxyapatite and it goes into a blood vessel, what happens then? So what's your take on that?
So it's, all the treatments come with risks, and the delivery system is really important to kind of reduce that risk. So I'll quite often just use a cannula. We're using it very, very superficial. We kind of call it skin scraping. So it's just right underneath the skin, and that's a very, very low risk area for any, occlusions to happen. We're constantly moving the cannula and assessing the skin. So I think it's a lot to do with product placement and actually knowing how to use the product effectively and safely, right? And the technique. So I mean, it's every treatment has its risks, but it's about weighing up that balance.
100%. I think, look, you dye your hair, there's a risk of an allergic reaction. You have surgery, there's a risk of not waking up after surgery. You cross the road, there's a risk that you have a car accident. You get in a car, you get in a plane. Risks are always there, and ultimately you have to weigh up that risk. And calcium hydroxyapatite, yes, you can't dissolve it, but it all comes down to technique. And it's an FDA approved product, so it's been around for a really long time. Radiesse itself has over 200 clinical papers, so it's a product that is heavily tested.
Yeah.
It does what it says on the tin. It's the highest G prime filler, so it's fantastic for structural support. But I'm not going to use it in the nose. I'm not going to use it in areas where actually it's very risky. The nose is an area that's very complex because of the vasculature. So you've got to use your brain, right? So you inject the right product in the right area, like you said. But also there's an on-label use, which is the placement in the jawline to help improve the jawline. And I personally do not like hyaluronic acid gels in the jawline. I think, you know what, they're overused. They result in puffiness because hyaluronic acid is a polysaccharide. It's a molecule that sucks water into the skin. So if we're placing a water-sucking product into the tissues, it may look nice that day, that month, maybe that year, but after that it's going to get puffy. So we really need to be conscious of that. And when I see women in particular with hyaluronic acids in the jawline, I think, oh my God, that is not going to age well. So you can't just think now short term. You've got to think, how is this product going to age long term? And I think that's where calcium hydroxyapatite works phenomenally well, because it doesn't suck water in. It gives that structural support, that definition, that precision. But the beauty, like you said, is it's a scaffold for collagen stimulation. So you inject that underneath the surface of the skin, and actually collagen sits on there and starts to proliferate, and you get more and more and more collagen. So you're actually reversing skin aging, and that's really, really interesting. And long term, that means if you've actually increased the collagen density in the skin, you're not going to need fillers as much anyway. So that's a no-brainer. And that's what I'm saying to all my patients now is, listen, fillers are great for giving you lost volume, but they are not an investment because they will go down over time and you will need to replace them. Collagen stimulation is an investment, and that means it gets better and better with time. So regenerative medicine is 100% the future. If you can regenerate your own collagen, it's a no-brainer.
I know, because unfortunately, as you know, it decreases over time. So from the age of around 26, it starts to go down about 3% a year.
Collagen.
Collagen, in our skin. So I just think that anything that we can inject is going to stimulate that and boost that. Amazing. Because we just get better results long term.
So you love Radiesse.
Yes.
I love Radiesse and I love Sculptra. Sculptra is a different product. It doesn't work the same way, does it?
Tell me more.
So Sculptra is a polylactic acid. And it works by causing an inflammation in the skin. So it goes down a different cascade or a different pathway. And often patients say to me, which one, Radiesse or Sculptra? And the answer isn't necessarily one or the other, as with all of our treatments. Sometimes it's both at different times. So Radiesse is great because it's a collagen stimulating treatment that is non-inflammatory and acts as a scaffold. Sculptra works really well in more of an aging patient who perhaps has lots of crepiness in their skin, and we want to really stimulate that collagen production. You can use it in the face, you can use it in the neck, you can use it also in the buttocks to create new collagen. But it is an inflammatory process. So in some patients who have a compromised immune system, it's not something that I would use. Patient selection. Also, I think with Sculptra, it's got a funny history as well. So it's been around for a really long time. It was actually when it first came out, it was used for HIV lipoatrophy.
Yes, I remember you telling me this actually. It's so interesting.
So patients who have HIV can lose a lot of fats very quickly, and they end up being very, very gaunt. And what ends up happening is they kind of hide their face in hoodies or behind their hair because, of course, we know that you're judged based on how you look, whether we like to admit that or not. And so naturally, if you've lost a lot of fat in your face, you start to look quite gaunt, quite skeletal, quite unhealthy. People start to stare or question why, and that can bring about its own distress. And so Sculptra was used to stimulate new collagen. And in the, I want to say olden days, back in the olden days, it was used in a different way to stimulate collagen, but we couldn't always predict its endpoint. So it would make new collagen and then make new collagen and then make new collagen. We didn't know its endpoint. And it was associated with risks of lumps and nodules. So I'm quite risk averse. I don't like to use something where I don't know the end result or it doesn't have a predictable endpoint. So I stopped using it back in 2017. until it was reformulated last year. And now with the reformulation, it's fantastic, because now, yes, we're using it for collagen stimulation, but we're also using it for skin boosting, because it's stimulating collagen, elastin, hyaluronic acid. You're getting more generalized skin boosting properties.
Yeah.
So that's great. So you're using it alongside your other treatment modalities, like your deep dermal fillers, to give back that skin glow.
Okay.
But then there's also Profido. You know, there's lots of biostimulators on the market, and people don't know. They come in and they go, "Oh, can I have Profido because it stimulates collagen?" But it doesn't quite, does it? You've done Profido on me recently.
Yeah. So that is a huge misconception, I think. Profido is beautiful. It's lovely. It's great for hydrating the skin and the face. It can be used in the hands. But basically how it works, it helps produce fat tissues, something called I can never say this properly.
Adipocytosis. Yes.
Yeah, that one. So that's how it works. It kind of helps to plump up your fat cells.
Yeah.
So with the skin, it's going to plump it. It's going to help smooth kind of crepiness in the skin, fine lines and wrinkles. And because it's hyaluronic acid based, it's going to give you that hydration back to your skin. But it does not produce new collagen at all. It works completely differently.
Huge misconception, right? I think Profido had great marketing.
Yeah.
And everyone comes in and goes, "Oh, can I have Profido?" And there's also Profido Body, and it works well, but it's a hyaluronic acid.
Yeah.
And it does stimulate the fat cells, but it gives you a glow. And I personally think, and I see a lot of patients with skin of color, I personally think it works better in Caucasian white patients than it does for darker skin types, for whatever reason. I don't know if that's something that you've noticed.
Yeah, I know we had a discussion about this before, but I tend to use a lot of different types of skin boosters. You know, that maybe they don't just give the glow, they might help with acne scarring and things as well. So there's more than one tool in the toolkit. I think it's always just about patient selection and product selection to get the result that we want.
You're exactly right. It's not one size fits all, is it? And I think, you know, that's why people say to me, "Oh, well, what filler do you use?" And I say, look, it depends on the patient. You know, we only use premium fillers, and I think that's really important because there's over 200 different fillers in the UK.
Yes.
It's hugely underregulated. You can be a plumber, take a day course, and the next day you're injecting filler bought off eBay into someone's face, or buying fake toxin from a man in a white van. And people think I'm joking.
I know.
But like, this is a real problem, right? Like literally these things happen. So it is scary, and it's really important that patients are informed to go to a medical practitioner, ask what filler they're using, and only use premium fillers that are backed by science, backed by data, that have a high safety profile, a low risk profile. And Profido is a great product. It's a biostimulator, like you said, but it's not a collagen stimulator. So how often are you did it on my hand. You're going to do my second session today, so I'm really excited. But tell me, how often are you injecting Profido? What are you saying to patients in terms of longevity?
So you do need at least 2 sessions, kind of 4 weeks apart. And it will last, you know, around four months or so. So it
like
is
your toxin.
Yeah, a little bit like toxin. So it is something that you would, you know, do a couple of times per year, or you know, maybe just have it in the summer and the winter to kind of give you that glow back when all our skin gets dehydrated with the cold. So yeah, it is something that you would have a little bit more regularly. A lot of people come in for their tox treatment, and then they may have some Profido as well. So it's multiple times a year.
Yeah, that's a good idea. Summer and winter. So kind of summer glow, winter dehydration. And we know that the more hyaluronic acid you have in the skin, the less likely your barrier function will be compromised. But now we're hearing different things. So we've got Sculpture, we've got Radiance. These are both scientific backed products that will stimulate collagen. They've been around for a really long time. Then there's new stuff coming onto the market, like fish sperm. Crazy, huh? I always wonder, how did you even think about injecting fish sperm? How did you come about that? How did you discover this? So polynucleotides, exosomes, these are all kind of new ones. Exosomes are like running wild. Polynucleotides are great as well. And that's something that we offer here at the clinic and has also been gaining a lot of momentum. So polynucleotides, what are they, hey? So they're strands of DNA or RNA that come from fish, specifically salmon,
isn't it?
And you inject them into the skin and they stimulate new collagen. You can get them in different densities. You can use them in the jaw, you can use them in the face, you can use them under the eyes. I've actually had polynucleotides. You know, I don't hide what I have. And I think it's a great, I'm a huge believer now in collagen stimulation. So the more we can stimulate your own collagen, no brainer. You get yourself, get that working for you, especially pre-menopause. You know, that you're maybe a little bit further away from that than I am, but the next big thing for me will be my 40s. That's the, you know, it's not my next birthday, but that's the next big thing. And then we start talking about that perimenopausal phase, and perimenopause, you start to lose collagen rapidly.
Yeah.
When you lose collagen, like you said, over the age of 25, from the age of 26, you are aging, you're losing 1.5% of your collagen. And collagen gives you structural support in your skin. Elastin gives it its bounce. Hyaluronic acid gives it hydration and glow.
Yeah.
So as we're losing that year on year on year, we're starting to get these fine lines and wrinkles creeping up, particularly around the eyes. And then you hit the perimenopause, and in the menopausal phase, you're losing 30% of your collagen. So it's a rapid decline in the skin quality and the integrity of the skin. So polynucleotides are huge. Radiesse is huge. Sculptra is huge. Profilo, it's going to replace lost hyaluronic acid, but it's not going to do anything for your collagen. Then there's exosomes.
Yes.
So this is exciting.
Yes.
Now, exosomes are an interesting and new thing to the market. They are, I think of them like little bubbles of messengers, if you like, and they are vesicles, and they are not stem cells, but they give targeted messages. So it's actually illegal to inject human-derived exosomes. In the UK, you can't inject that into the face, but you can topically microneedle it.
Yeah.
And what will happen is it diffuses through the skin, and then it goes to its targets, whatever that might be. It might be skin as a target, it might be hair follicles. So it's important that when you're having exosomes, you're having good quality exosomes. You understand that they are messages, so you can have bad messages, you can have good messages. And when I say that, you can have messages that say, hey, make new collagen, and then you can have messages that say, hey, make cancer. So bad messages should not be injected. So it comes down to, again, quality. You don't want to be injecting exosomes that will stimulate a bad pathway, an inflammatory pathway, a cancer pathway, a skin aging pathway. You want to inject or use exactly the messages that are going to switch on collagen formation, wound healing, new blood vessels, and target it to the right area. So if you want new hair and you can target hair loss, then you want to have hair specific exosomes on the scalp. So it's amazing. You can have plant derived ones or human derived ones. I know people go, oh my god, human derived ones. And there are human derived ones that are working very, very well, and the science will continue to develop. It's still limited, but there's certainly good science in the background. So I think regenerative medicine is huge.
Yeah, it's definitely the way forward, I think.
Yeah, and you can double up, can't you? So you can you can have radiesse, and then you can have skin boosters, and then you can have microneedling radiofrequency or microneedling with exosomes. It's not one size fits all. It depends on the patient.
Yeah, it really helps with the healing as well, the exosomes, like after you've had like a laser treatment or microneedling treatment. So
like me. I had CO2 laser like a month ago.
Did you have the exosomes after?
I did.
Ah,
I did. And then I shared my whole I went on live and I shared people. I think people were like, "Oh my god, your face is falling off," because I had scabs on my face, but it was so easy to cover up and it healed so quickly. And what exosomes do that nothing else really does is take away inflammation, because when we do things like CO2 laser, which is for resurfacing, I've got really bad acne scarring, when you do trauma, when you create trauma in the skin, you are starting this wound healing response, and your body starts to create new collagen, but at the same time there's inflammation, and remember, inflammation is the enemy of all things good. So you want to take down the inflammation. So exosomes come in and they reduce inflammation really quickly. So you don't get pro-inflammatory, you get anti-inflammatory, and that helps with the collagen stimulation and the healing. So my CO2 laser, I healed within 7 days. I literally went back to work the next day. I could cover it up with sterile makeup. It's amazing. So it's not like the olden days. People think CO2 laser, they think Sex and the City, skin peel, Samantha looking crazy, red and scary. But it doesn't have to be like that anymore. So I had exosomes. I'm a huge believer. My inflammation went down really quickly. And I'm really happy I do it again.
Your skin looks amazing.
Thank you. Well, I'm excited to get my second session for Fido today. So, any other things that you want to tell our listeners about regenerative medicine?
Yeah, I think with regenerative medicine, I think it's just a lot of people don't know about it. So it's nice to kind of go through the different types and actually explain them for patients. Skin boosters, we know people ask for those, as I've mentioned, and we've got so many different types, but they're not necessarily regenerative, but they can target different things as well. So I think making that distinguishing between them is super important for patients.
I agree. And ultimately, treating patients as the unique people that they are. It isn't one size fits all. You
Yeah.
know, we're not brand ambassadors who are going to pick up one filler because that's what the manufacturers tell us to do. It's about assessing the person in front of you and being really honest, ethical, and saying, okay, actually, if you've got acne scarring, this is the best skin booster.
Yeah.
If you've got age spots and you've got laxity in your skin, let's use Radiesse.
Yeah.
You know, if you've got pigmentation, let's use Bellaterra Revive. If you've got acne scarring, let's use skin boosters, because they all have their own unique properties. And that means that we have to respect our patients and use the right product for the right patient. Something I really strongly believe is patient comes first, you know, and as ethical medical practitioners, our duty is to care for our patients first and foremost. And I think we have to move away from being pressured by manufacturers to only use one specific filler for all patients, because it's not really. You wouldn't go to your doctor and be like, hi, I've got a rash, and they go to you, well, I can only prescribe one cream because that's what the manufacturers say, or I can only give you paracetamol, don't try ibuprofen because I get paid by paracetamol. Do you know what I mean?
I know,
so it's
a good
really
example.
important. Like you got, imagine your doctor could only give you one antibiotic. You would walk out of that doctor's office and go find another doctor. So your doctor has to have a wide range of experience, understand all the products out there, and select the right product for you, the patient. So yeah, I think this has been a really
good chat. I know, it was really good.
Insightful chat.
Absolutely.
Thank you so much, Lauren, for
welcome.
joining us. Lauren, I want to ask you, our next person joining us, what question would you like to give them?
What
should we talk about next
made them get into aesthetic medicine?
Oh, I love that.
Yeah.
Okay, we'll open up with that one next. Cool. Thank you for joining me, Lauren.
Welcome.
I shall let you go because I know we've got to do our profiler before you go off to Newcastle, and we'll see you again soon.
Thank you. You too.
Thank you. Thank you. Stay tuned, guys, for the next one, and we'll see you soon.